Hey Alpha Nurses, I'm Licensure from alphanursguy.com. This is 15 practice questions. Without the way, let's get started.
After a few minutes of conversation, a female client who is depressed wearily asks the nurse, "Why pick me to talk to? Go talk to someone else." Which of the following replies by the nurse is best? 1. I'm assigned to care for you today if you'll let me. 2. You have a lot of potential and I'd like to help you. 3. I'll talk to someone else later. 4. I'm interested in you and want to help you. The correct answer is 4. I'm interested in you and want to help you. Rationale. The nurse tells the client that the nurse is interested in her to increase the client's sense of importance, worth, and self-esteem. Also, stating that the nurse wants to help conveys to the client that she is worthwhile and important. Telling the client that the nurse is assigned to care for her is impersonal and implies that the client is being uncooperative. Telling the client that the nurse is there because the client has potential for improvement will not help the client with low self-esteem because most people develop a sense of self-worth through accomplishment. Simply saying that the client has a lot of potential will not convince her that she is worthwhile. Telling the client that the nurse will talk to someone else later is not client-focused and does not address the client's question or concern. The primary health care provider prescribes fluoxetine orally every morning for a 72-year-old client with depression. Which transient adverse effect of this drug requires immediate action by the nurse? 1. Nausea. 2. Dizziness. 3. Sedation. 4. Dry mouth. The correct answer is 2. Dizziness. Rationale. The presence of dizziness could indicate orthostatic hypotension, which may cause injury to the client from falling. Nausea, sedation, and dry mouth do not require immediate intervention by the nurse. A client diagnosed with major depression spends most of the day lying in bed with a sheet pulled over his head. Which of the following approaches by the nurse is most therapeutic? 1. Wait for the client to begin the conversation. 2. Initiate contact with the client frequently. 3. Sit outside the client's room. 4. Question the client until the client responds. The correct answer is 2. Initiate contact with the client frequently. Rationale. The nurse should initiate brief, frequent contacts throughout the day to let the client know that he is important to the nurse. This will positively affect the client's self-esteem. The nurse's action conveys acceptance of the client as a worthwhile person and provides some structure to the seemingly monotonous day. Waiting for the client to begin the conversation with the nurse is not helpful because the depressed client resists interaction and involvement with others. Sitting outside of the client's room is not productive and not necessary in this situation. If the client were actively suicidal, then a one-on-one client-to-staff assignment would be necessary. Questioning the client until he responds would overwhelm him because he could not meet the nurse's expectations to interact. A nurse is conducting a psychoeducational group for family members of clients hospitalized with depression. Which family member's statement indicates a need for additional teaching? 1. My husband will slowly feel better as his medicine takes effect over the next 2 to 4 weeks. 2. My wife will need to take her antidepressant medicine and go to group to stay well. 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. 4. My mother might need help with grocery shopping, cooking, and cleaning for a while. The correct answer is 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. Rationale. Additional teaching is needed for the family member who states her son will only need to attend outpatient appointments when he starts to feel depressed again. Compliance with medication and outpatient follow-up are key in preventing relapse and rehospitalization. The statements expressing expectations of feeling better as medication takes effect, needing medicine and group therapy to stay well, and needing help with grocery shopping, cooking, and cleaning for a while indicate the family's understanding of depression, medication, and follow-up care. The client is taking 50 milligrams of lamotrigine daily for bipolar depression. The client shows the nurse a rash on his arm. What should the nurse do? 1. Report the rash to the primary healthcare provider. 2. Explain that the rash is a temporary adverse effect. 3. Give the client an ice pack for his arm. 4. Question the client about recent sun exposure. The correct answer is 1. Report the rash to the primary healthcare provider. Rationale. The nurse should immediately report the rash to the primary healthcare provider because lamotrigine can cause Stevens-Johnson syndrome, a toxic epidermal necrolysis. The rash is not a temporary adverse effect. Giving the client an ice pack and questioning the client about recent sun exposure are irresponsible nursing actions because of the possible seriousness of the rash. A client has been taking 30 milligrams of duloxetine hydrochloride twice daily for 2 months because of depression and vague aches and pains. While interacting with the nurse, the client discloses a pattern of drinking a 6-pack of beer daily for the past 10 years to help with sleep. What should the nurse do first? 1. Refer the client to the dual diagnosis program at the clinic. 2. Share the information at the next interdisciplinary treatment conference. 3. Report the client's beer consumption to the primary healthcare provider. 4. Teach the client relaxation exercises to perform before bedtime. The correct answer is 3. Report the client's beer consumption to the primary healthcare provider. Rationale. The nurse should report the client's beer consumption to the primary healthcare provider. Duloxetine should not be administered to a client with renal or hepatic insufficiency because the medication can elevate liver enzymes and, together with substantial alcohol use, can cause liver injury. Referring the client to the dual diagnosis program, sharing information at the next interdisciplinary treatment conference, and teaching the client relaxation exercises are helpful interventions for the nurse to implement. However, reporting the findings to the primary healthcare provider is most important. A client is scheduled for the first electroconvulsive therapy treatment in the morning. The client has been unable to sleep, but at 10 p.m. refused to take Restoral, as the nurse suggested. The client is still unable to sleep at 11:15 p.m. In what order should the nurse do the following? 1. Sit quietly with the client. 2. Encourage the use of Restoral. 3. Offer use of MP3 player with relaxing music. 4. Discuss specific concerns. The correct order is 1. Sit quietly with the client. 4. Discuss specific concerns. 3. Offer use of MP3 player with relaxing music. And 2. Encourage the use of Restoral. Rationale. The client is likely anxious about the procedure. The nurse should first spend time with the client and then discuss the client's concerns about the procedure. Next, the nurse could suggest the client listen to relaxing music. The use of the sleeping medication would only be considered as a last resort since it might interfere with the effectiveness of the seizure required for the treatment. The nurse is planning care with a Mexican client who is diagnosed with depression. The client believes in Mal Oyo, the evil eye, and uses treatment by a root healer. The nurse should do which of the following? 1. Avoid talking to the client about the root healer. 2. Explain to the client that Western medicine has a scientific, not mystical, basis. 3. Explain that such beliefs are superstitious and should be forgotten. 4. Involve the root healer in a consultation with the client, primary healthcare provider, and nurse. The correct answer is 4. Involve the root healer in a consultation with the client, primary healthcare provider, and nurse. Rationale. Including the root healer gives credibility and respect to the client's cultural beliefs. Avoiding talking about the healer demonstrates either ignorance or disregard for the client's cultural values. Negative comparison of root healing with Western medicine not only denigrates the client's beliefs, but is likely to alienate and cause the client to end treatment. A client is receiving paroxetine 20 milligrams every morning. After taking the first 3 doses, the client tells the nurse that the medication upsets the stomach. Which of the following instructions should the nurse give to the client? 1. Take the medication an hour before breakfast. 2. Take the medication with some food. 3. Take the medication at bedtime. 4. Take the medication with 4 ounces of orange juice. The correct answer is 2. Take the medication with some food. Rationale. Nausea and gastrointestinal upset is a common, but usually temporary, side effect of paroxetine. Therefore, the nurse would instruct the client to take the medication with food to minimize nausea and stomach upset. Other more common side effects are dry mouth, constipation, headache, dizziness, sweating, loss of appetite. Taking the medication an hour before breakfast would most likely lead to further gastrointestinal upset. Taking the medication at bedtime is not recommended because paroxetine can cause nervousness and interfere with sleep. Because orange juice is acidic, taking the medication with it, especially on an empty stomach, may lead to nausea or increase the client's gastrointestinal upset. The client exhibits a flat affect, psychomotor retardation, and depressed mood. The nurse attempts to engage the client in an interaction, but the client does not respond to the nurse. Which response by the nurse is most appropriate? 1. I'll sit here with you for 15 minutes. 2. I'll come back a little bit later to talk. 3. I'll find someone else for you to talk with. 4. I'll get you something to read. The correct answer is 1. I'll sit here with you for 15 minutes. Rationale. The most appropriate action is for the nurse to remain with the client even if the client does not engage in conversation with the nurse. A client with severe depression may be unable to engage in an interaction with the nurse because the client feels worthless and lacks the necessary energy to do so. However, the nurse's presence conveys acceptance and caring, thus helping to increase the client's self-worth. Telling the client that the nurse will come back later, stating that the nurse will find someone else for the client to talk with, or telling the client that the nurse will get her something to read conveys to the client that she is not important, reinforcing the client's negative view of herself. Additionally, such statements interfere with the client's development of a sense of security and trust in the nurse. A 16-year-old client is prescribed 10 milligrams of paroxetine at bedtime for major depression. The nurse should instruct the client and parents to monitor the client closely for which adverse effect. 1. Headache. 2. Nausea. 3. Fatigue. 4. Agitation. The correct answer is 4. Agitation. Rationale. The nurse closely monitors the client taking paroxetine for the development of agitation, which could lead to a self-deletion attempt. Headache, nausea, and fatigue are transient adverse effects of paroxetine. The nurse is reviewing the laboratory report with the client's lithium level taken that morning prior to administering the 5 p.m. dose of lithium. The lithium level is 1.8 milliequivalents per liter. The nurse should 1. Administer the 5 p.m. dose of lithium. 2. Hold the 5 p.m. dose of lithium. 3. Give the client 8 ounces of water with the lithium. 4. Give the lithium after the client's supper. The correct answer is 2. Hold the 5 p.m. dose of lithium. Rationale. The nurse should hold the 5 p.m. dose of lithium because a level of 1.8 milliequivalents per liter can cause adverse reactions, including diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination, which are early signs of lithium toxicity. The nurse should report the lithium level to the primary healthcare provider, including any symptoms of toxicity. Administering the 5 p.m. dose of lithium, giving the client the lithium with 8 ounces of water, or giving it after supper would result in an increase of the lithium level, thus increasing the risk of lithium toxicity. A client was admitted to the inpatient unit 3 days ago with a flat affect, psychomotor retardation, anorexia, hopelessness, and suicidal ideation. The primary healthcare provider prescribed 75 milligrams of venlafaxine, extended release to be given every morning. The client interacted minimally with the staff and spent most of the day in his room. As the nurse enters the unit at the beginning of the evening shift, the client is smiling and cheerful and appears to be relaxed. What should the nurse interpret as the most likely cause of the client's behavior? 1. The effexor is helping the client's symptoms of depression significantly. 2. The client's sudden improvement calls for close observation by the staff. 3. The staff can decrease their observation of the client. 4. The client is nearing discharge due to the improvement of his symptoms. The correct answer is 2. The client's sudden improvement calls for close observation by the staff. Rationale. The client's sudden improvement and decrease in anxiety most likely indicate that the client is relieved because he has made the decision to delete himself and may now have the energy to complete the deletion. Symptoms of severe depression do not suddenly abate because most antidepressants work slowly and take 2 to 4 weeks to provide a maximum benefit. The client will improve slowly due to the medication. The sudden improvement in symptoms does not mean the client is nearing discharge, and decreasing observation of the client compromises the client's safety. The client is receiving 6 milligrams of selegiline transdermal system every 24 hours for major depression. The nurse should judge teaching about selegiline to be effective when the client makes which statement? 1. I need to avoid using the sauna at the gym. 2. I can cut the patch and use a smaller piece. 3. I need to wait until the next day to put on a new patch if it falls off. 4. I might gain at least 10 pounds from the medication. The correct answer is 1. I need to avoid using the sauna at the gym. Rationale. Selegiline transdermal system is the first transdermal monoamine oxidase inhibitor. The client needs to avoid exposing the application site to external sources of direct heat, such as saunas, heating lamps, electric blankets, heating pads, heated waterbeds, and prolonged direct sunlight, because heat increases the amount of selegiline that is absorbed, resulting in elevated serum levels of selegiline. Cutting the patch and using a smaller piece will result in a decreased amount of medication absorption, most likely leading to a worsening of the symptoms of depression. The client should apply a new patch as soon as possible if one falls off to ensure an adequate amount of medication absorption. Selegiline is not associated with significant weight gain, although a weight gain of 1 to 2 pounds is possible. After a period of unsuccessful treatment with amitriptyline, a woman diagnosed with depression is switched to tranylcypromine. Which statement by the client indicates the client understands the side effects of tranylcypromine? 1. I need to increase my intake of sodium. 2. I must refrain from strenuous exercise. 3. I must refrain from eating aged cheese or yeast products. 4. I should decrease my intake of foods containing sugar. The correct answer is 3. I must refrain from eating aged cheese or yeast products. Rationale. Cheese and yeast products contain tyramine, which the client should avoid to prevent a negative interaction with tranylcypromine, a monoamine oxidase inhibitor. Sodium will not interact with tranylcypromine, and neither exercise nor sugar needs to be limited.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.